Despite its name, heartburn has absolutely nothing to do with your heart, but some of the symptoms may make it feel like you're having a heart attack. In fact, studies show that over 1/3 of patients who experience chest pain were actually experiencing symptoms caused by GERD. According to the Harvard Medical School Patient Education Center, about 10% of Americans experience heartburn nearly every day, with 40% reporting that a nighttime heartburn affects their job performance the following day. The specialists at Advanced Gastroenterology and Surgery Associates explain what GERD is and how they treat it.
The most common condition we see in men, I think, would most likely be gastroesophageal reflux disease, especially with increasing obesity. We're seeing more and more cases of acid reflux, and the other reason it's important in men is that there's rising esophageal adenocarcinoma of the esophagus through a condition called Barrett's esophagus, and it's much more common in men than in women. So anyone who has a chronic history of acid reflux should probably have an endoscopy to look to make sure they don't have this change in the lining of the esophagus, which resembles the stomach. It actually is a motility disorder. People normally think that it's just acid, but it's just reflux of gastric contents into the esophagus that causes the symptoms. So it really is a motility problem. It's a problem of refluxing. We all have transient relaxation of the muscle at the end of the esophagus, so we all get a little bit of reflux. If you eat a pizza or fried foods, fatty foods, you'll get a little bit of reflux. But some people get it much more often. People with hiatal hernias, where part of the stomach is slid up into the chest, tend to be more prone to get acid reflux, and they tend to have more significant problems. But it really is a motility disorder. The medications, however, that we have actually just control the acid. They don't really prevent the reflux of gastric contents. That's why the anti-reflux measures, elevating the head of the bed, avoiding lying down postprandially, avoiding some types of food, some medications are vitally important, because we really have no great motility drugs to treat acid reflux. Cough is one of the extraesophageal manifestations of acid reflux. So people can reflux gastric contents all the way up the esophagus, can present with hoarseness. As a matter of fact, most of those patients actually are seen initially by an ENT physician, and they would subsequently refer to a gastroenterologist when they do a laryngoscopy and see a lot of erythema of the vocal cords. It's usually from acid reflux. It can present with asthma because of bronchospasm.
It has to do how the motility of the esophagus is. So in conditions where the esophagus does not function well to clear the acid when it is refluxed up, that's one. The intra-abdominal pressure is very important as well. For example, eating large amount of food at the same time causes the stomach to distend. So therefore, it causes acid to reflux up. It also has to do with the anatomy. So for example, if at the end of the esophagus is the lower esophageal sphincter, if that for one reason or another is quote-unquote loose, then acid can reflux a lot easier.
I think it's mostly lifestyle. Like everything else, there probably could be some genetic components, but it's so common. And like I said before, we all reflux to a certain extent. I think lifestyle sort of exacerbates it.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the Affairs of the Heartburn story link icon on our homepage at yourhometownhealth.com.